For many patients, surgery can be painful, especially in the first 48 to 72 hours. As a surgeon, I previously used local anesthetics to help manage their pain, but really found them to be most effective for the first 12 to 24 hours. Since the first 72 hours are considered the most painful, this created what we called an efficacy gap, and that's really where the opioids came in. They're cheap, but opioids are far from an ideal solution. With more than 50 million surgeries being performed in the United States and 2/3 of them filling prescription, you're thinking about hundreds of millions of pills that are being dispensed after surgery. ZYNRELEF is the first and only extended-release dual-acting local anesthetic. It's administered via a novel needle-free application and has been proven to reduce pain intensity for up to 72 hours after surgery, reducing or eliminating the need for opioids in many patients. One of the reasons local anesthetics and other longer-acting local anesthetics inconsistently provide pain relief beyond 12 to 24 hours after surgery is because there is inflammation at the surgical site. Inflammation changes the acidity of the surgical site, and that acidity does not allow the bupivacaine to enter the nerve cells to block pain signals. ZYNRELEF addresses this inflammation by combining bupivacaine with a low-dose NSAID called meloxicam, which is thought to reduce the acidic environment caused by the local inflammation, and thereby allowing considerably more bupivacaine to penetrate the cell and be effective in blocking the pain signals. In the head-to-head trials against bupivacaine in phase 3 clinical trials, ZYNRELEF demonstrated that it can reduce pain intensity for up to 72 hours after surgery, including a reduction in severe pain, what we consider 7 to 10 pain, and reduce or eliminate the need for opioids in many of those patients. When ZYNRELEF was used as the foundation of a postoperative multimodal analgesic program, patients' pain stayed in the mild range, and they needed either no opioids or a minimal amount to manage their postoperative pain. In the phase 2 EPIC TKA study that I participated in, patients treated with ZYNRELEF were considered ready for discharge earlier than those treated with the standard of care bupivacaine HCl or a saline placebo. In the first 8 hours, more than half of those patients treated with ZYNRELEF were ready for discharge. By 12 hours, post-surgery, it was nearly 60%, and by 24 hours after surgery, that number rose to over 70%. Total knee surgery is moving towards becoming an outpatient procedure, so same-day discharge is really important. The problem simply is that total knee surgery is a surgery where we use hammers and saws. It's considered a painful surgery. And we had good local anesthetics that can address some of that pain for the first 12 to 24 hours, but we just didn't have a product that could go out for the 72-hour inflammatory window. If you combine that with the fact that they're pushing towards having total knee arthroplasty being an outpatient procedure, in fact, it was Medicare approved to be an outpatient procedure over a year ago, then there is more of a need, therefore, to control the pain, especially in the early period. We didn't have good local anesthetics that would cover that period, but with the advent of ZYNRELEF, now we do. ZYNRELEF has been shown in multiple studies to decrease baseline pain from the moderate to severe range down to a range that is much more tolerable and can be addressed with other non-opioids such as oral acetaminophen or oral anti-inflammatories. In the EPIC TKA single-arm follow-on study that I also participated in, ZYNRELEF plus the scheduled non-opioid multimodal analgesic regimen kept patients' pain in the mild range, which is a 1 to 4 pain score through 72 hours, and the average opioid consumption was 25 morphine milligram equivalents. 39% received no opioid discharge prescriptions with no callbacks through day 11 of recovery. ZYNRELEF has the potential to have a major impact on how we treat postoperative pain. The decision to expand ZYNRELEF's use outside of the original 3 procedures provides surgeons with a new non-opioid alternative to alleviate pain relief for many patients undergoing these often painful surgeries. From my experience, because ZYNRELEF is administered without a needle, there is less administration time. In the larger, more painful procedures, such as total knee arthroplasty, using a product like ZYNRELEF can eliminate the need for up to 120 injections required by liposomal bupivacaine. And needle-free administration avoids the risks associated with injected local anesthetics, like intravascular administration and accidental needle sticks. Also, the needle-free application of ZYNRELEF requires no specialized training, so there's a short learning curve to learn how to administer it. It should be clear that ZYNRELEF cannot and should not be injected. It should be applied to pain-generating tissues. Prepare the syringe according to the instructions for use. When it comes to administration, don't dilute ZYNRELEF with saline or mix with another local anesthetic. Initially, we were applying it to every exposed deep tissue from the skin layer down, but I'm finding that just getting it deep into the surgical site while ensuring not to put it on the cut edges is sufficient enough for it to be effective. With motion of the knee or the foot or ambulation after surgery, the ZYNRELEF automatically coats the tissues at the surgical site. The product really gives great coverage at the amounts recommended. By doing so, I have not had to change my surgical technique at all. We've had excellent experience with ZYNRELEF. Not only did we have patients take less pain pills. I mean, to have a patient go through a knee replacement surgery and take 0 pain pills is unheard of. But we did see that in the trial, and I also see that now in clinical practice. But I will say the majority of the patients now take less than 10 pain pills. Before, patients were taking 60 to 90 pain pills. That was considered a standard. Now, less than 10. Furthermore, one of the things which I wasn't expecting, I'd see patients in the office 2 weeks later. They're there for their follow-up. That's when I take their staples out. But I could tell who's in the study based on how their range of motion was. I would see a patient and say, wow, that guy's motion's great. Was he in the study? I said, yep, he was in the study. Was that guy in the study? And he'd be struggling for 0 to 80 degrees. He wasn't in the study. And it was something really anecdotal that we saw, but pretty impressive also with ZYNRELEF. There's so many little vignettes, it's hard to pick one. It's like public speaking. Everyone gets butterflies until you've done it enough times that the butterflies go away. Having surgery is no different, but as a patient, you just can't go through enough to make those butterflies go away. So it really requires a surgeon to be a salesman and sell tranquility. The fear of pain keeps so many patients who often need a particular surgery out of the operating room. I've had to master the ability to discuss the problem and the solution in specific terms that people can relate to, like arthritic knees or like car tires, but those analogies are easily understood. I often see patients who really need a particular surgery to correct a problem, but hearing that the first few days was miserable is always deflating. Yet, I believed it was a necessary evil to get them where it needed to be. ZYNRELEF has really impacted that experience in such a positive way. In my practice, I just don't hear about the miserable first 2 to 3 days much anymore, and I know why. Being one of the drug trial surgeons was amazing, but hearing these same stories from other surgeons using ZYNRELEF that is now available throughout the country is even more rewarding. There's always going to be hurdles. Everyone hates change. But the status quo is simply not good enough, and if we want to see progress in the world of medicine, we have to adopt new and better products as they become available. If you're trying to convince your formulary committee, persistence is key. They are familiar with bupivacaine and meloxicam, the 2 active ingredients in ZYNRELEF, since they've been out for over 20 years, so most P&T committees know those products are safe. Every drug company has a spiel, and they often want to say how their product does this or does that. To some degree, that's true. But lowering someone's cholesterol or blood pressure will extend lives, sometimes decades into the future. That's great, certainly needed, but when it comes to pain, we need something now. When childbirth was considered one of the most painful things that women go through, they came up with the epidural. When root canals were considered terribly painful, they came up with long-acting local anesthetics. The void continued to exist with surgeries, and it was magnified by the push to do these surgeries as outpatient. I believe that ZYNRELEF now fills this void. It's highly effective, it's easily used, it's well tolerated by the patients, and it's safe.
Indication. ZYNRELEF is indicated in adults for instillation to produce post-surgical analgesia for up to 72 hours after soft tissue and orthopedic procedures, including foot and ankle, and other procedures in which direct exposure to articular cartilage is avoided. Limitations of use. Safety and efficacy have not been established in highly vascular surgeries such as intrathoracic, large 4 or more level spinal, and head and neck procedures. Important safety information. Warning: risk of serious cardiovascular and gastrointestinal events. Nonsteroidal anti-inflammatory drugs, NSAIDs, cause an increased risk of serious cardiovascular thrombotic events, including myocardial infarction and stroke, which can be fatal. This risk may occur early in treatment and may increase with duration of use. ZYNRELEF is contraindicated in the setting of coronary artery bypass graft, CABG surgery. NSAIDs cause an increased risk of serious gastrointestinal (GI) adverse events, including bleeding, ulceration, and perforation of the stomach or intestines, which can be fatal. These events can occur at any time during use and without warning symptoms. Elderly patients and patients with a prior history of peptic ulcer disease and/or GI bleeding are at greater risk for serious GI events. Contraindications. ZYNRELEF is contraindicated in patients with a known hypersensitivity. Example, anaphylactic reactions and serious skin reactions to any amide local anesthetic, NSAIDs, or other components of ZYNRELEF, with history of asthma, urticaria, or other allergic type reactions after taking aspirin or other NSAIDs. Severe, sometimes fatal, anaphylactic reactions to NSAIDs have been reported in such patients. Undergoing obstetrical paracervical block anesthesia or undergoing CABG. Warnings and precautions. Dose-related toxicity. Monitor cardiovascular and respiratory vital signs in patients' state of consciousness after application of ZYNRELEF. When using ZYNRELEF with other local anesthetics, overall local anesthetic exposure must be considered through 72 hours. Hepatotoxicity. If abnormal liver tests persist or worsen, perform a clinical evaluation of the patient. Hypertension. Patients taking some antihypertensive medication may have impaired response to these therapies when taking NSAIDs. Monitor blood pressure. Heart failure and edema. Avoid use of ZYNRELEF in patients with severe heart failure unless benefits are expected to outweigh risk of worsening heart failure. Renal toxicity. Monitor renal function in patients with renal or hepatic impairment, heart failure, dehydration, or hypovolemia. Avoid use of ZYNRELEF in patients with advanced renal disease unless benefits are expected to outweigh risk of worsening renal failure. Anaphylactic reactions. Seek emergency help if an anaphylactic reaction occurs. Risk of joint cartilage necrosis and degeneration with unapproved intra-articular use. Animal studies evaluating the effects of ZYNRELEF following intra-articular administration in the knee joint demonstrated cartilage necrosis and degeneration. Chondrolysis. Limit exposure to articular cartilage due to the potential risk of chondrolysis. Methemoglobinemia. Cases have been reported with local anesthetic use. Serious skin reactions. NSAIDs, including meloxicam, can cause serious skin adverse reactions. NSAIDs can also cause fixed drug eruption, FDE. FDE may present as a more severe variant known as generalized bullous fixed drug eruption, GBFDE, which can be life-threatening. If symptoms present, evaluate clinically. Drug reaction with eosinophilia and systemic symptoms, DRESS. If symptoms are present, evaluate clinically. Fetal toxicity. Due to the risk of oligohydramnios, fetal renal dysfunction, and premature closure of the ductus arteriosus with NSAIDs, limit use of ZYNRELEF between about 20 to 30 weeks gestation and avoid use after about 30 weeks. Hematologic toxicity. Monitor hemoglobin and hematocrit in patients with any signs or symptoms of anemia. Drug interactions. Drugs that interfere with hemostasis. Monitor patients for bleeding who are using ZYNRELEF with drugs that interfere with hemostasis. Example, warfarin, aspirin, SSRIs, SNRIs. ACE inhibitors, angiotensin receptor blockers, ARBs, or beta blockers. Use with ZYNRELEF may diminish the antihypertensive effect of these drugs. Monitor blood pressure. ACE inhibitors and ARBs. Use with ZYNRELEF in elderly, volume depleted, or those with renal impairment may result in deterioration of renal function. In such high-risk patients, monitor for signs of worsening renal function. Diuretics. NSAIDs can reduce natriuretic effect of furosemide and thiazide diuretics. Monitor patients to assure diuretic efficacy, including antihypertensive effects. Use in specific populations. Infertility. NSAIDs are associated with reversible infertility. Consider avoidance of ZYNRELEF in women who have difficulties conceiving. Severe hepatic impairment. Only use if benefits are expected to outweigh risks. Monitor for signs of worsening liver function. Severe renal impairment. Not recommended. Adverse reactions. Most common adverse reactions, incidence greater or equal to 5% in controlled clinical trials with ZYNRELEF, are soft tissue procedures, vomiting, and orthopedic procedures, constipation, and headache. Report side effects to Heron at 1-844-437-6611 or to FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Please see full prescribing information, including box warning and updated warnings and precautions for serious skin reactions caused by nonsteroidal anti-inflammatory drugs, NSAIDs.